Methadone. Methadone is a very effective medication and may be one of the most proven medications in addiction and psychiatry. It has positive impacts on mortality rate, infectious disease, as well as psychosocial outcomes like crime and incarceration. Methadone is a full mu opioid agonist. It is also an NMDA receptor antagonist. It can be very effective in covering somebody's cravings for over a day. At the same time, the impacts on pain last only 6 to 8 hours. A sufficient dose is needed for somebody to get the benefit of methadone. We know that when underdosed, the risk of using other opioids is very high. Therefore, it's very important to make sure that you're seeing a patient who is on methadone that they have a sufficient dose for their opioid use disorder, which would be at least 70 to 80 milligrams. Currently, for opioid use disorder, methadone is only available at an OTP or an opioid treatment program. There have been some recent changes to federal regulations that allow for OTPs to more easily dispense methadone, for example, around telehealth and take-home doses. There are a lot of practicalities to consider about opioid treatment programs, or OTPs. These are federally designated opioid treatment clinics and are the only places that people can get methadone for a substance use disorder. A doctor must place an order from a centrally managed system, and only the amount that was ordered is allowed to be dispensed. An individual has to present to the clinic on a certain schedule and obtain their dosing, which is usually in the form of a red juice to help prevent injecting. When patients are allowed to have take-home doses, they must keep with them the doses in a locked box and also keep all of the seals and labels in bottles. This is in an effort to reduce overdose risk to others and also to prevent diversion. As I noted earlier, federal regulations have recently changed such that OTPs can now dispense up to 7 days of take-home doses during the first 14 days of treatment and up to 14 take-home doses for 15 days of treatment and up to 28 take-home doses for 31 and on, if we believe clinically that a patient can safely handle this amount of take-home doses. Essentially, it is up to a clinician discretion about how many take-home doses somebody can get, and it can be up to a month depending on the case in most phases of treatment. This is extremely beneficial for people who may have had barriers to coming in and getting their methadone, who are trying to pursue school or work or other activities. Thus far, data indicates that there's no change to the level of misuse, diversion, or harm for methadone take-home doses, as we've learned from the public health emergency when exceptions were allowed for longer take-home periods. There are many potential side effects of methadone. Side effects can be respiratory depression, especially in people with risk factors. Common to most opioids are constipation, sedation, and hyperhidrosis or excessive sweatings. At high doses, it can be associated with QT prolongation, and screening within 30 days should be done for people with significant risk factors for QT prolongation, including a history of cardiac arrhythmia or prolonged QT interval, symptoms suggestive of arrhythmia, such as episodes of syncope, dizzy spells, palpitations, seizures, medications that may also contribute, hypokalemia, bradycardia, family history of premature death, or any other historical information suggested of a possible cardiac arrhythmia, or if the methadone dose is greater than 120 milligrams a day. In those with QTC intervals of greater than 500 milliseconds, methadone should be discontinued or other risk factors should be mitigated. Finally, drug interactions are notable for methadone, especially when patients are prescribed or stop taking a CYP450-34A inducer or inhibitor. CYP450 inducers like antibiotics, things like rifampin, antiretrovirals, and anticonvulsants such as carbamazepine can increase methadone metabolism. Inhibitors can decrease metabolism and increase the risk of over-medication with methadone. Examples of these are some antibiotics like ciprofloxacin, antacids like cimetidine, antifungals like fluconazole, antidepressants like sertraline, and more. Methadone can also impact other medications, and interactions are always very important with methadone. Key points around methadone are that methadone is a very effective medication for opioid use disorder, impacting many outcomes in addition to opioid use. Methadone is effective in pregnancy. Methadone can only be dispensed as an OTP or an opioid treatment program, which has many restrictions. However, changes to regulations in 2024 have made it slightly easier for patients to access methadone sustainably, For example, provisions to allow for more take-home doses. Methadone has many side effects. A less common concern, however, an issue for people with risk factors is QTC prolongation. Other side effects are sedation, respiratory depression, and constipation, as occurs with other opioids. There are also many common medications that can induce and inhibit methadone metabolism.